The NSIA Diagnostic Centre, NUDC, is a world-class diagnostic centre. This is a major investment in the development of healthcare delivery centres across the country and a clear demonstration of the commitment of the Buhari administration to the well-being of Nigerians. NUDC's sole objective is providing quality healthcare and access to quality laboratory and radiology investigations. We run a fully automated system which reduces human intervention and traffic, thereby enabling speed, quality delivery of service, and leaves no room for errors. Once a patient comes into the reception, his or her data is entered into the system. The tests to be run is done electronically. It's back-coded and pops up on the cashier's system, and when payment is made, it triggers a pop-up at the specific laboratory the patient needs to run the test. The diagnostic center has 6 phlebotomy suites, which is basically for collection of samples such as blood, urine, or any form of samples from the patient.
So this is a digital X-ray, and another X-ray supplied by Toshiba for us to use to work. This is a mammogram machine for screening for breast cancer.
(4D) ultrasound scan, which enables you to see structures not visible to our eyes. Screens are available for a clear visibility experience for both the staff and patient, which gives the patient a clear picture of what is being explained by the doctor. X-ray is done, it appears on the screen of the consultant radiologist to look through it and report it. The entire process is electronically done. CT scans, up to 64 slides, and connected electronically to the laboratory information management system. Automated laboratory and radiology are part of the external quality assurance program. The laboratory, fully automated, is upstairs and has limited access to ensure safety of the samples and high-tech equipment used. From the way the blood is collected to the way X-ray is done and the sample flow at the laboratory, every step is time-stamped, which gives an opportunity to monitor the turnaround time.
So this is the laboratory, and it has some of the latest and most sophisticated equipment in Nigeria or in West Africa today. And if you look and if you see, all the fridges are probably labeled and what is inside each one of them and which department they belong to. The temperature is controlled. Here is where the samples that are collected all downstairs or that are brought from different hospitals, they come here and this is where they are received in the lab.
The diagnostic center has a consultancy firm that ensures that the staff are up to date, which is why we have the seminar room to have both internal and external trainings.
Contrary, doing it different.
Staff welfare is of extreme importance to us. They work on a shift system. The facility has a tea room and staff lounge for breaks because it's a 24-hour facility, and to ensure that services are not disrupted, comfortability is key.
This is the server room. We are heavily leveraged on IT. And so we had to install a massive radio and fiber into this facility to be sure that we get internet in.
The center is disability friendly, with a toilet specially designed for the disabled, and pathways are available for easy access into all parts of the facility for disabled patients. The diagnostic center deliberately limited patient activities downstairs because it would be uncomfortable for an ill patient to climb the stairs to access care.
Thank you very much for joining us at today's commissioning of the Federal Medical Centre Umuahia NSIA partnership to create a world-class radiology and diagnostic centre. This centre started many years ago as a journey between the NSIA and FMCU when Dr. Godwin Okafor came into my office to make a plea for FMCU to be included as part of the pilot cases of the PPP projects for the NSIA in healthcare.
The partnership between the National Sovereign Wealth Investment Authority and the Federal Medical Centre is part of the public-private partnership that we're talking about when you're talking about healthcare financing. Government cannot bear the cost of funding health alone, so the private sector has to get involved, and this one is a typical example of a private sector involvement, and we're hoping that it will succeed maximally so that other private sector investors will see what has been done in Umuahia, probably Kano and Lagos, and then come in to invest more in health.
This is the second diagnostic center, but our third healthcare facility, and this is just over a period of 1 year.
Our vision for healthcare is as follows. Number one, we would like to reduce the level of healthcare tourism. Number two, we would like to provide quality healthcare for our people. Thirdly, and more importantly, we would like to provide tools that will make sure that our healthcare professionals are able to deliver at the highest levels of their profession.
Let me put it on record that results you get from that diagnostic center, it's as good as any result you can get anywhere in the world, be it India, Dubai, America, UK, anywhere in the world is the same standard. The quality assurance is top-notch, and we're hoping that we're going to maximize on this center and make Federal Medical Centre Umuahia a place to reckon with.
Healthcare as a sector is one of our focus sectors. Within the healthcare space, our strategy is focused on three broad buckets. The first is diagnostics, particularly a co-located strategy with tertiary institutions.
Earlier this year, we also commissioned a world-class radiology and diagnostic center at the Minikano Teaching Hospital and now Umuahia. Our pipeline includes 14 such projects. We are going to be working in partnership with the Ministry of Health, the Ministry of Finance, and other entities of government to make sure that we deliver on our vision.
It is really critical that the healthcare professionals, the doctors and other people that provide care to Nigerians have credible sources of diagnostic data that they can use to determine what's wrong with their patients before they treat them. So this is really a very important part of the healthcare chain that we are intervening in.
I'd also like to acknowledge the efforts being made by Dr. Lowe at the Federal Ministry of Health, the Minister of Health, the Minister of State for Health, the PAMSEC, and everybody outside the Federal Ministry of Finance who joined in making sure that this has come together to where we are today. I want to congratulate everyone here today, and I want to wish everybody well, but particularly I want to single out the management and the staff of the Federal Medical Centre Umuahia. This center is our center. We're looking forward to working together as we make this a profitable and sustainable center, and over time transferring it back to the FMCU Umuahia. I'm very proud of what we've accomplished today, and I'm hoping that the journey ahead will be much better for everyone. Thank you very much.